Coma. Not really a term that we utilize a lot in the pre-hospital environment. What would you call somebody who's having a coma or is in a coma? They're unconscious, unresponsive, right? So unconscious, unresponsive. These are our GCS patients of like 3. All right, they're in a coma. As far as pathophysiology on why, what do you think? What do we need to go through? What algorithms? You need to go through AIU tips, right? This is basically our ALOC patients. So AIOU tips, right? Because there's so many things that can do it. You need to look into their past medical history and figure out when they were normal. I should say last seen normal. Okay? So you've got this unconscious, unresponsive, altered patient that normal baseline is they're alert and oriented, walking, talking, and self-sufficient. You have to figure out why are they unconscious and unresponsive. So in our assessment of these patients, after we've considered AIU tips, you have to look at some common signs and symptoms that lead up to coma. So these are things that you're going to get from bystanders or family members that may lead you to believe why their situation became worse to the fact that they're now unconscious and unresponsive. So some of these are a decreasing level of consciousness. It progressively got worse and worse to the point that they're at now. They may have complained or exhibited confusion. They may have even seen hallucinations. We have somebody that's delusional. Have some sort of a psychosis. Or they were just complaining of feeling sleepy. Right? This all can somewhat be explained through our AIU tips. Now, only a very few of those are we really able to reverse. Right? Possible narcotic overdoses, maybe some sort of trauma, maybe it's an oxygenation thing. Other than that, all we know is that we've got an unconscious, unresponsive patient that we really need to be focusing on ABCs. And with that, we need to control that airway. So you may end up having to intubate this patient to protect that airway. So when you're doing your assessment of these, even if they're not quite unconscious, but they're just not really responding appropriately, you're still going to go through AIU tips, and you're going to be looking for any deficits in their speech, in their movement, just like we would with strokes. All right? We really can't determine if maybe they're altered in this degree because they're having a stroke. It's a neurological emergency, and we really can't tell the difference between a stroke and some sort of organic process that's going on. Right? So the main thing that you're going to do is just make sure that you're supporting ABCs and protecting that airway. All right. We're going to get into seizures.